Burns are a special type of soft tissue injury. They are classified by depth into 3 different categories: superficial, partial thickness, and full thickness burns. Superficial burns, or first-degree burns, are dry, red, swollen, painful burns involving only the first layer of the skin. Partial thickness burns, or second-degree burns, involve blistering, mottling, and clear fluid on the top layer of the skin. Lastly, full thickness burns, or third-degree burns, lead to black or brown charring of the skin, white appearing subcutaneous tissue, extreme pain or relative painlessness, and extensive damage to underlying fat, muscles, bones, and nerves. For our purposes, we will only discuss the treatment of first-degree burns, as they are more commonly seen by those who are first aid certified.
Here's a list of materials that you will be using to treat burns. First, a cell phone, which may be used to activate EMS. Second, sterile gauze or dressing. Third, gloves. Fourth, eye goggles or eye protection. Fifth is unscented moisturizer or aloe vera gel. Sixth is a flashlight. 7. An automated external defibrillator or AED. 8 is rigid objects that can be used for splints, like so. 9th is bandanas or pieces of fabric that can be used to tie the splint. 10th is a towel. 11th is a blanket. 12th is a 12-inch object such as this chair that can be used for elevation. And lastly, a sink, hose, or other source of running water, like so. One of the most important roles of a first aid provider is knowing when to activate the emergency medical system. Dial 911 if the victim has 1. Trouble breathing. 2. A burn covering a large area of the body or a large percentage of the surface area of the body based on the rule of nines or the Palomar surface method. 3. Suspected burns to the airway. Indications include burns to the mouth or nose. 4. Burns to the head, neck, hands, face, or genitals. 5. A full thickness burn and the victim is less than 5 years old or older than 60 years old. And lastly, number 6, a burn caused by electricity, explosions, or chemicals. The most common type of burns that you will care for are heat-related burns, also called thermal burns. Sources can range from flames on a candle to even ovens. The signs and symptoms of thermal burns include pain, swelling, redness, blistering, moistness, or a lack of sensation in the affected area. Fatalities due to heat-related burns are usually caused by airway closure, inhalation of toxic smoke, or other trauma. Further complications such as infection and fluid loss might occur several hours after the burn.
Vanilla cupcake. Ah! Help! Help!
I'm scanning the area. I don't see any downed electrical lines, broken glass, car accidents. It looks like the area is clear. You, call 911 immediately. The burn is affecting the hand, which is a crucial area.
Got it.
Now I'll apply my PPE. First, I'll put on some gloves in order to protect myself from any contaminated body fluids. Here's the second glove. I'll even apply some eye protection goggles just to be on the safe side. Now let me move this away. I'm blowing out the candle. I'm going to check for any life-threatening injuries. I don't see any burns of the nose and mouth, so it doesn't look like you've inhaled any smoke from the candle. Now I'll remove this bracelet because it's not stuck to the burn. I don't want your hand to swell and you won't be able to get that off. Now let's flush the area with cold water immediately. I'm now going to turn on the sink and leave it on for about 20 minutes. That should cool down the burn. It looks like your burn should be cooled off by now. Let's turn off the water. Do you have any sterile gauze or dressing?
There's a first aid kit behind you.
Great. I'm going to use this clean dressing. Since the burn is in such a small area of the body, I'm going to wet it first. Okay, I'll apply that nice and loosely. I'm going to use this bandage to keep it in place as well. And I'll use a second piece just to ensure that it doesn't move around. Okay, great.
Go.
Okay, let's lay you down. I'll make sure to support the head and neck. Now I'll get this object, it's about 12 inches, and I'll put it under your feet. Now I'm going to use this blanket so that you don't get chilled or overheated. This is because victims of burns are very susceptible to hypothermia. They cannot regulate their body temperature. Lastly, I'm going to assess the vitals. I'm checking breathing and pulse. Both of the vitals look good, so no CPR will be indicated. Don't worry, you're going to be okay. Recognizing a radiation burn, also known as sunburn, is a fairly common skill. Since this type of burn is closely related to thermal burns, the signs and symptoms may typically seem like a first-degree heat burn. These include pinkness or redness, skin that is hot to the touch or warm, pain, tenderness, itching, swelling, or even small fluid-filled blisters. For a more severe sunburn, the signs and symptoms include headache, fever, chills, and fatigue. Care for a radiation burn using the same method that we just showed was used to treat heat burns. Remember to always cool the burn and keep the person away from the source of the burn in order to prevent any further injury. Always remember that the first priority in first aid care is to prevent further injury. Therefore, the most important step you can take is to remove the victim from the source of the burn immediately. However, in order to avoid these scenarios completely, you must follow safety precautions to prevent burns whenever it is possible. First, heat burns can be prevented by following safety practices that prevent fire and being careful around sources of heat. Learning how to prevent and treat burns, you can apply this information to help burn victims in your community. You have the knowledge. Now use it.